Welcome. Today, we're going to cover how to succeed in a virtual integrative private practice. And to cover this, we have Dr. Chanel Heermann. And I met Dr. Heermann through the American Telemedicine Association. I am so glad to have her with us for this because she's definitely an expert in the field. She received her medical degree from the University of Nebraska Medical Center and went on to complete her psychiatry residency at the University of Arizona in Tucson. Dr. Heermann was one of the first 121st physicians in the world to be certified by the American Board of Integrative Medicine. She graduated from the University of Arizona Center for Integrative Medicine's fellowship program. She's board certified both in psychiatry and integrative holistic medicine. Dr. Heermann is a telepsychiatrist. We like that. With almost 15 years of experience providing services via video conferencing technology, including over 10 years in integrative telepsychiatry through her private practice, which spans 7 states. She has successfully started up telemedicine programs in multiple different organizations across 2 countries and 3 U.S. states. She also serves as a consultant for psychiatrists interested in starting up their own telepsychiatry private practices. She's also the creator of MH Direct, which is an online directory designed to specifically meet the unique needs of telemental health private practices. MH Direct uses an innovative search method to reach patients across the entire state, ensuring that everyone is able to find the ideal professional to help them. So it's another fantastic online directory that you could utilize to market your practice. So integrative psychiatry, Dr. Heermann, maybe we could start with that in terms of, can you explain what integrative psychiatry is? What does that entail?
There are a lot of really lovely definitions. I should look up the Arizona Center for Integrative Medicine, now the Andy Weil Center for Integrative Medicine, has a really nice long, paragraph long definition, but it's basically, the way I look at it is it's using what works. It's looking at the whole person and then combining the best of both alternative and traditional medicine into a treatment plan that works best for that particular person that's sitting in front of you. It really tries very hard not to be kind of a cookbook, kind of, this symptom plus this equals that. And it's really,
I think I've heard of a cookbook like that.
Right? Wouldn't that be nice? I want the magical cookbook that makes people not depressed anymore.
No, but I mean, I'm thinking like the DSM-5, right? Is that
right?
That's sort of a cookbook, right?
It is. It's got its own issues.
So I really like this a lot because when you say, do what works, it's not just medicine, right? So, hey, you have this particular struggle going on. Let me think of what medicine is going to solve that. But there's other things that you do, such as nutrition, right? Can you give us like an example of integrative medicine that would be different from a traditional just psychiatry?
Yeah, I mean, the interesting part about integrative medicine is it's really sort of straddling these 2 worlds, this sort of like complementary alternative stuff and the conventional medicine. So I wind up kind of bringing people towards the center. At least that's the way I like to think of it. So either I will get somebody who comes in and they think they just need a pill to fix the thing that's wrong. And we'll sort of use that to, okay, so there's this thing that's wrong. What could we maybe do that would not involve pills? Maybe we go ahead and do the pills. Maybe if you're really invested in that, but what can we do to make the pills work better? So maybe you get involved in some mind-body medicine techniques. Maybe we look at your diet. We can look at, are you moving your body at all? That's huge for both anxiety and depression. And there's a whole assortment of other techniques, and people may not have thought of those things. They might even find certain supplements, vitamins, herbs, things like that might actually be helpful. Maybe we don't need to add another pill, or maybe we add a pill that has something a little more natural inside of it. So that it kind of goes that direction. Or sometimes it'll go the other way, where I'll have somebody who's lifestyle is absolutely on point. I mean, they're exercising every day and they're meditating and they've got this wonderful supportive group of friends and they're eating better than I am. And they come in and they're still not feeling well. And for those folks, sometimes I'll have the opposite conversation, which is there's no prize for getting through life without being on psych meds. Sometimes you need just a little touch to kind of help all this other stuff come together so that you have an awesome life. Good. That's the prize. The prize is the awesome life, and we're going to put together whatever we need to for the ingredients to make that happen.
Yeah. I like that a lot. And I wonder, well, I hear more and more physicians, talking about other ways of healing, like mindfulness and exercise and stuff like that, stress reduction things. But also they might feel like, hey, it's outside my competence area and I'm trained in medicine. I don't know. I'm just doing mind reading. But you've been trained in both, and I'm sure that helps with you have that competency. You have a lot of tools to offer a client, and again, what you said, just trying to figure out what's going to work for that particular individual given their situation. And again, I'm not a physician, but I don't know. I like going to a healthcare provider where they think, hey, there's these options. Let's try this. It may or may not work. And if it doesn't, I'm going to continue working with you, right? To figure out what is work, right? Yeah.
And it depends on you. I mean, what really speaks to you, what doesn't? I mean, I can send you out with instructions to go do some, some breath counting, some mindfulness meditation, some stuff like that. But I've also run into patients where sitting and trying to just meditate makes them panicky. So for those folks, I might send them towards like yoga or some Tai Chi or Qigong, sometimes just having something to focus on. So, you're in your tree pose and you have to pay attention just enough so you don't fall over. And that's enough to keep your brain on point and keep it from, running off to bad places. So it just kind of depends on the person. Some people, this X, Y, or Z thing just does not appeal to them. And so we work around that.
Yeah. So it makes me think, like, why not go to an integrative psychiatrist rather than go to someone who's not an integrative psychiatrist? So
that's a great question. I don't know. That's what I do. I mean, honestly, when I have friends and family who are like, where should I go see? I go check my little integrative psychiatry referral lists and who've been through the sort of trainings that I've been through. And then a lot of it has to do with just sort of walking your talk. I mean, you want to go to somebody who's actually tried this stuff. Because like you say, sometimes you get into I just did medicine and I'm not trained in doing this stuff. And it was interesting for me, and I don't think I'm the only one, but where it took me quite a bit of training before I actually started using it on patients. Like I knew lots of stuff, but I still felt shy about bringing it up, right? And you get to a certain level of practicing it on yourself, practicing it with people close to you, poor families. We're experimenting on them. And you get to the point where, I mean, that was honestly what I feel like the biggest thing I got out of my fellowship was I finally got to where it was just a habit, where I just offer this. This is not like a thing where I wait to see if you're the sort of person that I imagine might be into this. Everybody finds out about this, whether you're, a rural veteran or, a young 30-something woman or, and everybody in between, everybody gets offered this, and whether it lands for them or not is kind of up to them.
Whereas medicine, you're not going to try that on yourself and family, but you have studies, right? So with medicine, like there's, you have a lot of studies and research and stats. Is there that kind of research with the other modalities, other, techniques of healing that you utilize?
There actually is, and that's part of that's actually part of how the Arizona Center exists, is because that's actually part of their medical school. They've got enough research in there that they were able to create. It was the program in integrative medicine when I went, and it became big enough that now it is the Center for Integrative Medicine. So to become a center in a university system is a big deal. That's you have been, granted the legitimacy and whatnot. So sorry about that.
No worries.
I started working from home, and then the dogs. But I mean, and especially like mind-body medicine in particular has so much research that it's sort of it's almost gone mainstream. Like when I first started, mind body medicine was kind of woo woo. You didn't necessarily talk about it with everybody. And now, everybody's got a mindfulness based group somewhere in their center. And so it's interesting watching those kind of shifts. And I've forgotten exactly the quote, but they're talking about sort of the evolution of techniques in medicine. And at first they you start out and everybody thinks, that's obvious that couldn't work and you're crazy and that's never going to work. And then it shifts somewhere along the line where you have enough research. Suddenly it's crazy that you would think that wouldn't work. Of course that would. And they just sort of act like it was a foregone conclusion the whole time.
Right. Like with telemedicine, right? Providing this service virtually through video.
Yeah, totally bonkers. And now we have COVID and everybody's doing telehealth. And I don't have to explain to people what telehealth is anymore, which is really interesting.
Right. So you really gravitated towards the telehealth and you've been doing virtual visits for a long time. So what got you started in providing it, virtually? Because like you said, there was kind of the thought process of, oh, you can't really build rapport or assess or whatever, through video, which is debunked by research and experience and all that kind of stuff. But so how did you get started when you did?
My very, very first telemedicine experience was through the VA, which makes sense because the VA has been doing telemedicine for something like 30 years. That's the vast majority of the research we have on telemedicine comes out of studying veterans because that's just what they do. So I used to do telemedicine from one VA clinic to a different VA clinic. So the veterans still had to come in and sit themselves in front of a different little video screen, but you could cover the entire rural Nebraska with this one video camera. But I've been doing this long enough that I remember the times where we had the old, the huge, I probably shouldn't give any brand names, but the great big video conference devices, and they're on a big wall, and you're at the end of some conference table, and it has all the intimacy of, hollering at someone from one end of a conference table to another, and like, are you crying? I hope he's not crying. I can't tell because the pixels are so bad. And so I remember those days. Nowadays, it's like sitting in the same room. You just forget that you're across the state or across the country. It's made.
So you started doing this because your employer said, do this, right? Okay.
Well, I mean, honestly, I've always been kind of a tech nerd, so I probably volunteered. I don't remember exactly, but I bet I did.
Right. Yeah. So with integrative medicine, is there anything missing through video that really, causes a problem where you maybe can't provide the services that you really want to provide because it's through video or phone or any other kind of virtual method?
I mean, there are some limits to it. I mean, I miss hugging people. I really do. Like it's.
So you hug your patients?
I mean, not routinely, but occasionally. When you're saying goodbye to somebody you've seen for several years, when you're somebody's having a particularly rough time and they ask for a hug. Like I actually have a little Hugs Heal mug from back in my AHMA days, the American Holistic Medical Association. That was one of their mottos. Like that was on all of our T-shirts. Hugs Heal.
Oh,
one of their top 10 things about what is holistic medicine is that love is the most powerful medicine. And so it was a very sort of touchy kind of culture. I mean, obviously you ask permission, consent matters, and you don't just walk and hug people who don't want them. But
do you have a way of giving a virtual hug?
Actually, the closest thing I've come to, I'll show you. Actually, I can't see my video, so I won't know when I've got my. Let's see, how do I see my video? I'll just show you. I do this in groups sometimes. We'll do sort of a little group hug, and if I put my hands up to the edge of my video screen, and you put your hands up to the edge of your video screen, we can have a little pretend. We can hold hands
like
a little bit,
or like this,
like up to the edge of your camera. See, and then we get a little hug going on. Yeah. And so
cool. We're creating like a box, right?
Yeah, exactly. So like if we were going to hold hands in a group, except that we're doing it through the little picture screens.
I like it. Yeah.
So I mean that's always an option. But I know there are places where they have more practitioners on site. Like I know I have friends who have holistic treatment centers where you come and there's a massage therapist and an acupuncturist and a chiropractor, and they're all in the same building. That part is really, you can't do that virtually. The chiropractors kind of need to put their hands on you. the acupuncturist could probably teach you some acupressure over the video, but that's all. And you can't really do massage. You can do self-massage. That was
well, we know that, you know, there's studies that show that if you had a novice resident come in and do an assessment of a patient and touch them, right, where they were saying they had pain or whatever, and then you had, you know, the best doctor ever, right, come in and do an assessment but not touch the patient's going to say that the more competent one was the one that touched him.
Right.
Yeah.
I mean, I lose some of my important clinical information this way. I used to do a lot of telehealth into like a community mental health center. So the patient would still come to the center somewhere in, you know, rural Colorado or somewhere, and the nurse would bring them in and then I would see them. But then the nurse was there. So the nurse could be like, he smells like weed today.
Right.
He hasn't showered for a while, right? So you don't get that level of information. Like, I mean, because sometimes I can tell, like, if you've got a little bit of, you know, this morning's breakfast still on your shirt, maybe it's not this morning's breakfast, and we need to talk about how often you're changing your clothes. And so I can tell how depressed you are by some of those little bits of information that I'm not going to get in people's house. The flip side of that, though, is that I get to see your surroundings. So I get to see how you're interacting with your kids or your dog, or are the dishes piled up to heaven knows where. So you get different kinds of information. It's just different.
Right. That seems like even more significant information. I would think, being an integrative psychiatrist, looking at the whole picture, being able to see the picture, right, of their environment, and they could even show you more by, you know, walking around their space.
What's in your refrigerator? What have you actually been eating? You know, what is actually in that supplement you said you're taking? Because normally they show up to your office and they're like, I started taking this new thing that's good for anxiety. And I can have them run to the bathroom and read it off to me. What was that I was taking? Yeah, if you didn't bring it into the office, it's going to be hard. And, you know, and just in terms of follow-up after seeing you, like, I know for myself, when I see a doctor, it's so great to be able to follow up with them by sending them a message through the secure messaging and saying, hey, that worked, or hey, that didn't work, you know? Do you find that there's more of that kind of correspondence and follow-up? I get a ton of secure messages or emails, or however you do that in your practice. Secure messages are obviously much more safe. I started this in the Wild West when we used to just email each other, but now there's
but you get a lot more that you've seen that go up in terms of people sending messages.
And I know some doctors would rather have them come in and have a visit. We don't make changes in between visits, but honestly,
you can charge for that visit if they come in.
Well, there's that. But honestly, I am busy enough that I would rather answer your question in 5 minutes, and then we'll see you at your next visit to follow up. If it's a really complicated question, I will ask them to make an appointment. But I get a lot more sort of instant feedback when it doesn't take a bunch of effort to let me know how did that go, or I decided I hated that thing you gave me, and I stopped taking it. It's a good thing to know now rather than a month from now when they've decompensated somehow because they've stopped taking whatever it is they were supposed to be taking.
Oh yeah, it's definitely better quality care, I think.
For sure.
So in terms of marketing, like being successful as an integrative psychiatrist, I'm sure that a lot of psychiatrists, they want to be in private practice, have their own gig, maybe be a consultant for different organizations, get the word out. That can be really hard because they're trained as psychiatrists and they should be just focused on that, not focused on marketing and building a business and so forth. So you help people get started and launch their private practice in an effective way. Can you give us some thoughts on how can they market effectively for, integrative psychiatry?
It's interesting. It's sort of a combination of probably 2 or 3 things. There's sort of having an online presence, and that doesn't necessarily mean like social media per se or those sorts of things. I actually find that at least in integrative psychiatry, because it is sort of a unique niche kind of practice, that most of my patients find me on their own. So I have my name listed on a number of these sort of online directories, having completed this, that, or the other training, or board certified in this thing, and then I'll be on your little find a practitioner directory. But people aren't always looking for telemedicine there, which is part of the reason that I created the MH Direct. The other reason is that a lot of those directories search by physical address. So the patient puts in their zip code, and then they find doctors within 25 miles or 5 miles, or therapists, within this little radius of their zip code. But of course, in telemedicine, that has no bearing at all on whether you can see them. If they live close to a border, their little circle might include people over the border. You can't see them. Or it's just going to leave this entire chunk of your state empty. So even if they make a great big circle, there's still going to be corners, because nobody's state is a perfect circle.
Right.
And that really is, for telemedicine, that's all that matters is, are you licensed in the state? So every directory I've ever been on besides my own searches in these weird little circles that don't really work for telemedicine. So that's why we set ours up so that it searches just by state boundaries. You find people throughout the entire state, and there aren't these huge chunks of little rural corners somewhere where they're never even going to know you exist. Yeah,
and it's Your Mental Health Direct, right? Directory. Can I show your site?
Yeah, sure.
Yeah. All right. So this is the website, Your Mental Health Direct. And what you would do is just, click on the state. So
like you get on Colorado, where I'm at, and I show up
in New York.
We're in New York. We get a lot of people in New York.
So I'm in New York, and then I have, other filters where I can filter and find the clinician I'm looking for, the category, what they specialize in, specific location, etc.
Right.
So if you're struggling to find a telehealth provider specifically, that's great. I know that's very, very helpful. So being listed on directories sounds like there's organizations who provide certifications in specializations, and they have their directories.
Yeah, like yours. If somebody was specifically looking for a trained certified telemental health person, your directory would be a good place to look. And as long as the patients can find those directories, they actually are kind of a slow but steady way to get referrals.
Right.
And then the flip side, ironically, is a lot of in-person sort of networking, like how you and I met at a conference. And it's interesting that even though I do most of my marketing online, most of my referrals are local here in Colorado. They are, or people that I knew from med school or residency. And it is, we are still, we are still humans. We are still little tribal animals, and we refer to people that we know. And so if you have actually had a coffee date with someone or met someone in real life at a conference, they are more likely to send patients your way. So if you're trying to build a long-term practice, having a referral network still matters, even in this day and age where patients mostly just go jump onto the web and find you themselves.
Right. I think there's a skill to utilizing your network. So it's not just meeting people, but being intentional to use them as a referral source and vice versa. Yeah. So are there particular things that you would recommend in regards to that? Like, first of all, you probably want to think of who it is that you want to network with, and then how to establish a relationship in a way where they are going to send you referrals.
Honestly, I think the most important thing is wanting a genuine connection with that person. Like, I really want your business to succeed too. This isn't just about me getting my name out there and trying to get you to send me people. Like, if that's how you're gonna come across kind of salesy, and people don't like that. People don't like to be sold to, but people love to build relationships. And so I did a thing for a while. I actually got this idea from James Maskell and the Evolution of Medicine people, was to send introduction letters to people. And so I sent them letters, and then I called them on the phone, and I was terrified because I'm cold calling random strangers, even though they're other colleagues. And it was way less scary than I thought it was going to be. I actually had a really good time.
Right.
And it was, because we're all in our little silos. We don't get a lot of conversation with other colleagues. And it was more like when you go to a conference and you just, hey, so what do you do, and where do you live, and do you have kids and pets and whatever, and those kind of conversations than a sales call. And so we'd spend 15 minutes on the phone kind of getting to know each other and say, okay, so who's your ideal patient that I should send you, and here's my ideal patient that I'd love for you to send me, and then that's it. That sort of, and then maintaining that relationship over time so that you actually do send people and do think of them.
Yeah, so you would send them a letter and then follow up with a phone call. Yeah, and then you would maintain that relationship by checking in, like every 6 months or so, or?
It kind of depends. Honestly, most of my check-ins are around mutual patients. So when somebody comes to see me that I think would be a good fit for them, hey, I sent you a person. And I always let them know that if I sent them a person, so even if the person doesn't call them, they still know that I'm thinking of them and that I am sending business their way.
Yeah, and for the care coordination piece, right?
Yeah, exactly. It's so much more fun to take care of patients as a team.
Yeah. And then you have a special offer for our listeners. Is that right?
I do. So we have actually a special discount just for your clients. I actually have to look up the discount code because I'm trying to remember what we called it. Sorry.
We'll put it in the will be in the description. So it's definitely gonna be in the description.
Yep.
With the link, so you will get a discount.
All right. So basically, they're just going to get a 25% discount off of their annual subscription. So it's good for an entire year. And it's actually on sale right now for half price anyway, because we just launched. And so this is part of our let's get somebody in every state. And it's for you, somebody's if we can.
Perfect.
Really trying to expand and get a lot of names on our list. And I'm really impressed by your program and your people. And so I wanted to support your folks too.
Excellent. I appreciate that. Yeah, our listeners very often want help with marketing. It's clinicians have a great thing to offer, and they want to focus on doing that and not have to be a marketing expert, and they need some help with marketing. So well, thank you very much.
Absolutely.
It's been very, very helpful. I really appreciate it. And again, Dr. Heermann's information and links to her practice and her directory are definitely in the description. Leave comments if you're on our blog page. And again, thank you very much.
Thank you. It was lovely.